Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to another episode of the Egg Whisperer Show. I am so excited about today's topic, everything you need to know about fibroids and fertility, because I have the expert on this topic. I have Dr. Banafsheh Kashani on today. Hi, Dr. Kashani.
How are you? So excited to be here.
Thank you for taking the time to talk to us about this. I get questions about fibroids and fertility all the time. So this topic couldn't have come, or this discussion couldn't have come at a better time. You guys, I want to tell you a little bit about Dr. Kashani. She is so impressive. So let me tell you about her. She's board certified in OBGYN and reproductive endocrinology and infertility. She works with or at Eden fertility centers and has been treating couples and individuals with infertility since 2014. She's graduated with lots of honors from University of California at Irvine, and she got her medical degree from University of South Alabama College of Medicine, where of course she graduated at the top of her class. She completed her residency in OBGYN at USC, and she got a lot of experience there. Then after USC, she did her fellowship in reproductive endocrinology and infertility at Rutgers, New Jersey Medical School, and I'm so happy to have you here. Bana, tell us about your practice.
Yeah, sure. So I'm here in Orange County and I treat couples from infertility to recurrent pregnancy loss. Obviously, I do a lot of cases of surgery, particularly looking at the uterus, uterine lining, everything related to fibroids, polyps, and scar tissue that can develop in the uterus. And I love what I do.
Thank you for being here. So you actually have done some really interesting research work on the endometrium and freezing embryos. Can you tell us about that?
Yeah, sure. So as a fellow, I looked at particularly endometrial stromal cells. I was right in the lab. I was focusing on what we can do to optimize things related to implantation pregnancy. I mean, that is the most important thing. You can get a perfect embryo with IVF and all of these things, but if it doesn't implant, what can we do? So I spent a lot of time looking at that. And then I had a lot of focused research looking at patients undergoing frozen embryo transfer trials. And we did a lot of work looking at big SART databases and trying to figure out what's going to give patients the best pregnancy outcome.
Awesome. Well, you're the best expert for this show. So before I start getting into questions, I want to just read something I found on your website, and I love this quote. I recognize each person or couple is unique and empathize with each and every patient. This allows me to help patients navigate all of their options and tailor my fertility treatment specific to their needs. So that's pretty awesome. Thank you for saying that. Okay, so let's get into it. What are fibroids?
Fibroids are benign tumors. They are made of smooth muscle cells, particularly sometimes thought to originate from the muscle layer of the uterus called the myometrium. 99% of the time they're probably benign, but they are just annoying. They're annoying things that are there that cause so many problems.
I love it. Annoying. They're annoying. That's true. They're annoying and buying things.
And they're common. Oh, that's another thing. They're very common.
Yeah. And then are all fibroids the same?
No. So the fibroids vary on where they're located within the uterus. Fibroids can be just hanging outside of the uterus. Those usually don't cause a problem. But the ones in the muscle, or particularly that impinge or enter the uterine cavity, those are the ones that are more problematic. So there's different kinds and different classifications for them.
And why do they grow?
Why? So mostly they're hormonally responsive. Every female has hormones such as estrogen and progesterone. They fluctuate throughout your cycle, and basically they're food for fibroids. They feed them and make them grow. And this happens also during pregnancy as well.
And then are there fibroid symptoms? Like, how would you know that you have a fibroid?
Some people don't know. It could be completely an incidental finding, meaning a finding that just happened to come up because they got a CT scan or MRI. But some of the main symptoms include things like heavy menstrual bleeding out of nowhere, really having very heavy periods, bleeding too many days. The other potential symptoms are pelvic pain and pressure, pain all of a sudden during intercourse with certain positions. And another common thing that comes up is like really progressively worsening constipation, having difficulty having bowel movements because there's something there. There's a tumor that's putting pressure on the colon.
And are there any risk factors that could increase someone's risk of having fibroids?
Yeah, absolutely. So I think the biggest recognized risk factor is in certain populations of patients. So African Americans, unfortunately, are more prone to fibroids. In fact, at age 40 or 50, maybe 70 to 80% of African American women probably have a fibroid.
Wow. That's a really high rate. That's a really high rate.
Other risk factors are age, and family history, high blood pressure, some diet, vitamin D deficiency. So there's a lot of different potential risk factors.
And then what can an individual do to prevent the growth of fibroids? What are the things that are in their control that they could do on their own?
So I think in everyone, a healthy lifestyle is good because there are some dietary associations. Too much caffeine consumption, alcohol can contribute. But in general, one of the things, if you're not trying for fertility, potentially suppression of your natural hormones through things like oral contraceptive pills could be a benefit to prevent them or prevent their growth. If you do have a fibroid, there's some medical management that can be done, but it really just depends on your goals.
And what are some of the medical management options that patients have, for example?
Yeah, so as I said, birth control pills can help because they suppress your hormones. There's an injection of a hormone called Lupron, and it's a long-term injection, either a month or 3 months, and it basically puts you in a temporary menopause, helps shrink that fibroid. And there's a newer medication called ulipristal acetate, and that has been studied and has shown to potentially help decrease the size of fibroids.
Great. So we just talked about medical management options, and I know there are a lot of surgical management options. Can you talk to us about those?
Absolutely. So every surgery that is offered to a patient is going to depend on what kind of fibroid you have and the size, first and foremost. The most minimally invasive option, it's a surgery done vaginally. It's called a hysteroscopy. The camera goes into the uterus, allows you to see if a fibroid is bulging into the uterine cavity, and you can then remove it. The alternative surgery is laparoscopic. It's a camera that goes through the belly button with other instrumentation to help remove fibroids, but you will have to make some incisions on the abdomen. And then the other surgery is like a C-section scar incision. It's an open myomectomy, removal of the fibroids, and basically putting the uterus back together.
Yeah, I think one of the questions patients ask me a lot is, if I go through the surgery, what are the chances that they're going to come back? What do you tell your patients?
That's a tough one. So it depends on how many fibroids you have. The more fibroids you have that were removed, and if they were bigger, higher chance of recurrence or coming back. I've seen things quoted from 30% all the way up to 50% after a 1 to 2 year mark. So it is possible that they will come back, and you'll have to be monitored after surgery for.
And how do you decide for your patients whether a fibroid should be removed or not?
First and foremost, if anyone has symptoms, I think that in itself tells you. Heavy bleeding or pressure symptoms, that tells you got to remove the fibroid. But beyond that, for fertility purposes, people go through fertility treatments, IVF, IUI, and I think the uterine cavity is where that embryo is growing. It's where the baby will grow for 9 months. And so if there's any possibility that there's a fibroid there that's going to affect the cavity, then absolutely it should be removed. We don't want to take any chances, or God forbid, even end up in a situation where someone is pregnant and ends up with a miscarriage.
Absolutely. But what are the risks for actually doing the surgery? Because of course everyone reads stuff online and they hear things that could happen in surgery, and they're really scared. And I think a lot of patients are more scared about the anesthesia part. So share some of the risks.
Yeah, so any surgery requires anesthesia, and that's a potential risk. Luckily, if a patient is healthy with no other medical problems, those risks are pretty low. But other risks are always going to be bleeding during surgery, possible risk of infection, possible risk of scar tissue development either in the uterus or outside of the uterus. And then, that could potentially cause compromised fertility in the future. Very rarely, a very large surgery to remove many fibroids could result in a lot of bleeding during surgery. There's a very rare risk of having to, have the uterus removed. But overall, I think that risk is very, very small.
Yeah. Okay. And then as far as the surgery itself, some patients verbalize to me that they're scared that the uterus won't recover well enough after surgery. How long do you tell patients to wait before they should try to get pregnant?
Yeah, I typically on average tell people to wait a 6-month time period if they had a major surgery like a laparoscopy or robotic surgery or open surgery. If you've had a hysteroscopy and the fibroid was in the cavity, you can try right away. But on average, I tell people 6 months. Everyone is different, though. Some people, they can proceed with trying as early as 3 months.
And do you go through the pros and cons of doing surgery and not doing surgery for patients? And can you just tell us what you tell them for people who are watching?
Every decision is individualized, obviously. And so it's a matter of weighing the factor of trying to perfect everything prior to getting pregnant, minimizing risk of miscarriage. For some people, a small fibroid may not make a big impact for them, and they just want to proceed with trying. And so every, situation is unique. Major pros are the fact that it could help symptoms, obviously, of bleeding, pelvic pain or pressure, and optimize fertility and reduce the chance of miscarriage. Cons are obviously it'll delay and postpone pregnancy, which no one wants to do, and then the surgical potential risks that are there.
And then in pregnancy, what are the chances that the fibroid is going to grow or go away?
Yeah, often, unfortunately, fibroids can grow during pregnancy because it's a state with lots of estrogen and progesterone. They don't necessarily go away. At the time of menopause, a lot of times fibroids shrink and are not really problematic, but pregnancy, unfortunately, is a condition that can make fibroids grow.
Right. And then is there something that women can have done when they're pregnant? If, let's say, their fibroids are growing, are there any medications they can use? Like I've heard, there are patients that I know have been offered things like Indocin, for example.
Yeah, if you're experiencing pain, which can happen because of a fibroid, that is something that can be used to help with pain during pregnancy. But unfortunately, a lot of the other medications can't really be used during pregnancy.
Right. And then if a patient has a fibroid and she wants to go see someone to remove it, how does she know that she's seeing the right surgeon?
That's so important. I'm so glad you brought that up. You need to ask, you need to be proactive and find out how many of those surgical procedures that person does. And, I think that makes a difference. The more procedures you do, that's the person that's well equipped to be able to do your fibroid surgery.
Yeah, I agree. I feel like if someone obviously there's always a risk of removing your uterus, but the surgeons that I've had my patients work with over the last over 10 years, they've never had to remove a patient's uterus.
Yeah, never.
Doing a fibroid surgery. Yeah. So the risk of that happening is less than 1%. So I feel like if you have a surgeon that tries to discourage you and say, there's a chance you're going to lose your uterus, and that might not be the best surgeon for you.
Yeah. And
right?
I think it's always wise to get a second opinion. Always. If you have any questions, seek out a second opinion.
Yeah. Do you think MRIs are needed for every fibroid or every fibroid surgery as part of the planning process?
Not for every case, but on a case-by-case basis, it can be very useful in preoperative planning, determining if it can be removed via vaginal route, hysteroscopically, or if really an open route is necessary. So case-by-case basis, MRI could be immensely helpful, but it's not required.
And what does the MRI tell you? I know there are different types of fibroids. Can you tell us a little bit about that as far as like adenomyosis and
Sure. An MRI can tell you if the fibroid's outside the uterus because it's a three-dimensional picture. It can tell you if the fibroid's within the muscle of the uterus, and also if it's impinging on the uterine cavity. So it helps delineate where it's located. It tells you size. Size is a really important factor in determining what kind of surgery. So an MRI can tell you that. And then it can tell you if something may look like a fibroid, but is probably not, which is another condition you suggested is adenomyoma or adenomyosis, which is a collection of abnormal cells, but it's not a well-circumscribed area like a fibroid. So it's not really recommended to remove those because those could be very tricky and challenging.
Awesome. So what advice do you have for people who, let's say, aren't close to someone like you as far as figuring out if they have fibroids or not, if they have symptoms? What can they do?
I think first thing you have to contact a OBGYN if they can't get in with a fertility specialist. Be proactive, ask for a basic pelvic ultrasound at the minimum, ideally a transvaginal ultrasound. And if there is anything else that's concerning, that can be followed up with further imaging like an MRI.
Do you think there's a role for, let's say, egg freezing or embryo freezing in someone who has fibroids?
Oh, absolutely. I'm so glad you brought that up. So many people who have fibroids want to avoid doing surgery because they're so worried about, oh my gosh, I'm going to wait to do my surgery, postpone 6 months or a year, and then I'm going to be, close to 40. Well, in that circumstance, the best thing to do is actually to freeze eggs or embryos so that timeline, that ticking, biological clock can be eliminated. And then you can proceed with transferring the embryo when the uterine cavity is corrected and everything is optimal. And that could be done at any point. And you've frozen your eggs or embryos at that age. That's, obviously hopefully younger with better quality.
And then what about IVF medications? Is there a chance that the IVF medications might cause the fibroids to grow back if someone's already had surgery and make them bigger?
It can in select cases. Again, it's estrogen and progesterone levels rise. So you definitely want to try to time transfer closer after fibroid removal, again, as long as it's safe.
Good. And then what do you do to prepare? So let's say someone's done their IVF, they've had their fibroids removed. How do you prepare them for a transfer? What is your special sauce?
Every one of my patients before an embryo transfer will have a uterine cavity evaluation, and I usually do a saline-infused sonogram in the office. It's a simple procedure, 10-15 minutes, and it gives me such a nice glimpse into the uterus to make sure that there was no remaining scar tissue or fibroid that could be affecting the cavity. As long as I feel comfortable the uterus is pristine, then we'll proceed with transfer. If I have any question, we can proceed with a more helpful test, which is actually put a camera in the uterus and look, on a TV monitor and really confirm.
Awesome. Do you do that in your office or do you do that in the operating room?
I do both options. Okay. It depends on the patient.
That's
mostly
great.
In the operating room though.
Great. So Bana, this has been a great show. I mean, I'm so glad you were able to give us all this extremely helpful information about fibroids and fertility and pregnancy. Is there anything you want to tell our listeners about fertility that you want them to know?
Oh, of course. Be proactive with your fertility. It's so precious. Age is so important, and you just don't want to take time to lose out on a window. Again, if you even wonder about it, people have an intuition, just seek a consult. Especially now, telehealth is available. All these options are available. Be proactive so you never look back and say, gosh, I wish I looked.
That's perfect. I mean, I think a lot of people are afraid that if you talk to someone like us, it means that they have to sign up to do some sort of treatment, but the reality is different. I mean, the reality is you can see Dr. Kashani and get your fertility levels checked. So tell us again, where can patients find you?
Oh, sure. So I'm in Orange County, specifically Newport Beach at Eden Centers for Advanced Fertility. You can follow me on my Instagram at Dr. Kashani, and that's pretty much it.
Awesome.
Love to see you. Love to help anyone out.
Thank you so much for being on the show. We'll find another reason to have you back on. It's been so
great.
Good. Thank you again. Sure.
Bye.
Thanks again. Bye, guys. Thanks for watching the Egg Whisperer Show, and we can't wait to see you next week. Have a great week.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Ivf Medications.
And you have yet another success story.
Just launched by an East Bay fertility doctor.